everyone. In today's video, we'll understand what is rotator cuff, anatomy of the all four muscles, their functions and movements, common injuries and why they occur, and most importantly, how the physiotherapist helps to restore the movement and functions after rotator cuff injury. While lifting your arm, have you ever experienced a shoulder pain while lifting your arm? Just trying to reach something on the shelf and feeling pain on sleeping one side? If yes, then one of the important structure involved could be a rotator cuff. The rotator cuff is not only important for gym enthusiasts or athletes. This is important for everyone because rotator cuff involved throughout the day in every movement of the shoulder joint. From combing your hair to wearing a shirt, lifting a bag or throwing a ball, rotator cuff is working continuously in the background. Yet, despite being so important, rotator cuff injuries are most common in worldwide. So let's start with what is rotator cuff. The shoulder joint is the most mobile joint in the human body. It is also called as a glenohumeral joint. Unlike a hip joint which is deep and stable, shoulder joint is most mobile. The shoulder sacrifices stability over mobility. Because the shoulder is shallow, it requires more additional structure to stabilize the shoulder joint. And one of the most important stabilizing structure is rotator cuff muscles. These muscles originate from the scapula and inserts onto the humerus. The primary role is to stabilize the shoulder joint and maintain the alignment of the shoulder. Assist shoulder movement and prevent the excessive translation of the humeral head. The simple mnemonic to remember these muscles are SITS. S stands for Supraspinatus, I stands for Infraspinatus, T stands for Teres minor, and S stands for Subscapularis. Together they function as a dynamic stabilizer of the shoulder joint. Shoulder may be the superstar, but these rotator cuffs are the bodyguard of the superstar. So let's start with the supraspinatus. It is located above the spine of the scapula in the supraspinous fossa. Originate from the supraspinous fossa and insert in the greater tubercle of the humerus. And it is innervated by the suprascapular nerve. The supraspinatus initiate the shoulder abduction in starting 15 degree of the shoulder abduction. And after that, deltoid become the prime mover for the shoulder abduction. The supraspinatus tendon, you need to remember this. This is the most common injured tendon in the shoulder joint because it passes through the subacromial space. This is the most important clinical anatomy. You need to remember this to diagnose the supraspinatus tendon injury. So initial 15 degree of the abduction is done by the supraspinatus. So every large movement of the shoulder joint is initiated by the small supraspinatus muscle. So now talk about the infraspinatus muscle. This is located below the spine of the scapula and origin is from the infraspinous fossa. Insertion is in the greater tubercle of the humerus. Innervation is by the suprascapular nerve, same as for the supraspinatus muscle. So supraspinatus muscle and the infraspinatus muscle both having the innervation of suprascapular nerve. And the function of the infraspinatus muscle is external rotation of the shoulder joint. The movement is essential for throwing a ball, serving in tennis, opening the door, reaching your back, combing your hair. So all these movements are initiated by the infraspinatus muscle. So let's talk about the teres minor, third muscle of the rotator cuff group. It is located along the lateral border of the scapula and originates from the lateral border of the scapula and insert in the greater tubercle of the humerus. Innervation of the teres minor muscle is axillary nerve. You need to remember this. The function of the teres minor muscle is external rotation. So it helps infraspinatus muscle and they work togetherly to initiate the external rotation movement. Think of them as a co-worker and they are sharing the responsibility. So now let's talk about the fourth muscle, subscapularis muscle of the group. This is the largest and the strongest rotator cuff muscle located on the anterior surface of the scapula. It originates from the subscapular fossa and insert in the lesser tubercle of the humerus. And the innervation of this subscapularis muscle is upper and lower subscapular nerve. And the function is internal rotation of the humerus. So it contributes to tucking in your shirt, reaching to your back pocket, placing a hand behind the back. So these are the functions that subscapularis combinedly perform. So let's talk about the overall function of the rotator cuff. Keep the humeral head centered and stabilizes the shoulder joint while doing the movement. Prevent shoulder dislocation and coordinate in smooth arm movement. So one thing that you need to remember, without rotator cuff, deltoid can pull your shoulder upward and it will distort your shoulder biomechanics. So movement without stability is a chaos, and rotator cuff brings stability while performing a shoulder joint movement. It assists other shoulder joint muscles. So let's discuss rotator cuff injuries. So first one is rotator cuff tendinitis. So this refers to the inflammation and irritation of the tendon of the muscle. And it is common in painters, swimmers, cricket players, volleyball players, and gym enthusiasts. And the common symptoms are pain while lifting the arm, pain during overhead activity, mild weakness, tenderness around the shoulder joint. So now let's discuss rotator cuff impingement syndrome, one of the most commonest shoulder disorder. The tendon compressed between the humeral head and the acromion, and the repeated compression leads to the inflammation and pain. And the symptoms are sharp pain, painful arc, pain between 60 to 120 degree of the shoulder abduction and scaption, night pain, and difficulty in reaching overhead movements. And patient often complains that, doctor, I always feel pain when just trying to reach overhead things, whenever I just try to take something from the shelf. So you need to remember this clinical presentations of each problems. So let's talk about the partial thickness tear of the rotator cuff group. In this condition, only part of the muscle fiber tendon are torn and the tendon remains attached, and the common symptoms are pain, weakness, difficulty in lifting objects, and reduced endurance of the muscle. In this condition, patient still can move the arm, but the movements are painful. Now let's talk about the complete rotator cuff tear. This occurs when the tendon completely detached from the bone. It most commonly affect the supraspinatus tendon, and the symptoms are significant weakness and inability to lift the arm, loss of function, and severe night pain. These are the 4 symptoms which is most common. Some patient may require a surgical intervention, especially if the tear is large and functions are severely compromised. And risk factors are commonly associated if the patient is having an age more than 40, repeated overhead activity, poor posture, sports injuries, smoking, diabetes, and heavy lifting. So pain is not an enemy. It's a body alarm and system is asking for the attention. And the good news is most of the rotator cuff injuries respond well to the physiotherapy. So in phase 1, your focus should be to reduce the pain and to reduce the inflammation and irritation. So for this, you have following methods: activity modifications, ice therapy, and you can use also electrotherapy whenever it is indicated. And most important, patient education: what to do, what not to do. In phase 2, you should focus on restoring the mobility of the shoulder joint. And this loss of movement also develops because pain causes protective stiffness. So in the exercises, you can include pendulum exercises, band exercises, pulley exercises, and capsular stretching. And your goal should be to restore full range of motion pain-free. And in third phase, you should focus on strengthening of the muscle, rotator strengthening, scapular stabilization, and neuromuscular control. And in phase 4, you should focus on functional training. Once strength improves, then you should focus on sport-specific drill, occupational training, gym return program, throwing progression programs, and your goal should be in this phase safe return to the activity without reoccurrence. Don't just treat the pain, rebuild the movement that caused pain. So now let's recap. The rotator cuff group of muscle consists of supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles stabilizes the shoulder joint and guide the movement. Common conditions include rotator cuff tendinitis, shoulder impingement syndrome, partial tear, and complete tear. And physiotherapy play an important role in reducing pain, restoring movement, improving function, and reducing recurrence. Strong shoulder isn't built by the powerful shoulder muscle alone. It is built by muscle working together. If you enjoyed this video, like, comment, and subscribe Anand Physical Therapy Academy, because every movement has a science and every therapist should know this.